This is Pennsylvania Newsmakers, a fast-paced, unrehearsed weekly discussion with and about the leaders who shape your world. And now, here's your host, Terry Madonna.
Hey, welcome back to the program. Well, joining me is Dr. Stuart Shapiro. He's president and CEO of the Pennsylvania Healthcare Association. The host will be able to get these names out. Dr. Shapiro is one of the healthcare experts we call in from time to time. All right, one of the things we're going to talk about, Dr. Shapiro, first of all, welcome to the program.
Glad to be back.
Let's get on with the specifics of it. Look, baby boomers, you have some real concerns, and you've articulated those very well about how young folks, or baby boomers to be more correct, as they move towards senior citizen years, are just unprepared for what's coming. What are the top lines in that? What are the top 3 or 4 points?
Let me put it all in perspective. The good news is life expectancy in America has gone up dramatically.
And we like that.
And we like that. The bad news is it's going to have lots of people. And the systems are not prepared for health care, financially or socially. And let me put some meat on those bones. Polls have been done recently of baby boomers. Most of them think that they're never going to need long-term care when they get older. The facts are that 70% are at some point going to need sustainable, primarily in a facility, a nursing home, an assisted living facility, 70% some form of care. People have refused to talk about these issues. It's very uncomfortable. And if you look at who's going to pay for all of this care, and you do another poll, which has been done, and you do polls all the time, people believe Social Security, Medicare, Medicaid, or health insurance is going to pay for that care. Social Security doesn't. Medicare only pays for short-term rehab.
Days? Is it 90 days? Or
100 days after you come out of a hospital, and then it only pays for part of it.
Right.
Medicaid only covers the poor, and it does not have money to sustain it for these number of people, and health insurance won't. So people need to begin to have discussions.
Yeah, you know, is this, I think you've raised a couple of good points there. One of them, that, is it just that we're reluctant to talk about, you know, that people don't want to sit down and say, you know, we got to think ahead and look at what happens if one of us has to go into a facility. You know, as you pointed out, are we just reluctant to admit that?
The simple answer is people don't want to talk about it.
Yeah.
And they're very reluctant. Now, I can tell you that 90% of us are going to get frail, old, not be able to run around, and not live alone. And I can guarantee you, and I'm sure some of your viewers are going to be nodding their head, most people delay this discussion until a crisis happens. And then they scramble, where people need to, in their 50s and 60s, talk with their families, talk with their loved ones, talk with their spouses, talk with their friends about how they're going to address these issues before the crisis. And there's lots of solutions out there, and there's lots of people to talk to, and there's lots of ways to find care and plan for that care and visit facilities well in advance, so people are there. And I think you're going to show a website that lists some of these. But the way that you can find this care.
Website is up on the screen. Go ahead.
Great.
Yeah.
But
now
people just don't want to have that discussion.
But this is, as Meryl Streep might say, it's complicated. I mean, you've got, as you point out, you got long-term insurance, you got annuities, you got reverse mortgages, you got. I mean, there's a myriad of ways to potentially fund this. And when we tend to think of paying off mortgages, paying off our cars, paying off our debt, a lot of folks don't think, well, what happens if I need this long-term care? I think that's your big point. It's not one of those things that go into our thinking about our finances and our future.
Right. People are not thinking in their 40s, 50s, or even early 60s, should I buy long-term care insurance?
Right.
They're not saying, does my life insurance policy, which they buy, is there a conversion to pay for long-term care?
Right.
So I don't have to end up on Medicaid and be a burden to the state. The question really is, you said you had long-term care insurance,
right,
and other people are looking at long-term care insurance. Make sure when you do that it covers not only care in a nursing home, but also care at home. And not all the policies do.
I'll have to go check that tonight.
And you really, everybody should have those options in their policies when they buy it.
Wonderful point. Wonderful point. You're all listening out there to that. All right. We've had folks on who support the Medicaid expansion. You're not, you know, Governor Corbett still has to make the decision. The legislature would have to go along with, it would require some state funding. That decision has been in abeyance. You're not in favor of it. Why?
I'm not in favor of it.
Okay.
What I am in favor is exactly what Governor Corbett is doing. He's looking at the ramifications of expansion. The liberal knee-jerk reaction would be, oh, let's expand. Let's not look at what it will cost us a year from now and 5 years from now. Mm-hmm. That's not Tom Corbett. Tom Corbett is looking at, as he should, and the legislature is looking at it, as it should, is this going to work for Pennsylvania? Will there have to be a tax increase? And well, I don't want a tax increase. So the governor is thinking through these issues carefully, and he takes some criticism for moving slowly, but on this one, he is absolutely right. Just like he was absolutely right in the budget when he did it this year, and the legislature did it this year, state budget, to put in dollars to pay for the frail elderly in nursing homes. Right. So there was a place to do it. He looked at this as a priority. The legislature and the governor are also looking at long-term care priorities. They have a long-term care commission that was created, and the governor did something I think from a preventive standpoint is really good. Mm-hmm. He has created, by executive order, an Alzheimer Planning Commission. Alzheimer's disease takes us back to the first part of this discussion on the first half of the show, is a disease that affects the elderly. Right now, there's probably 400,000 Pennsylvanians who have Alzheimer's disease or one of the other dementia-related diseases. Yeah. These are diseases just like heart disease, just like lung disease, that need to be reduced. And they can be reduced by simple preventive measures, like exercise, which also reduces heart disease, like brain activity, like keeping your cholesterol down, like losing weight. But what they are doing is they're addressing both the legislature and the governor. They're saying priorities are the frail elderly, and these are the way it should be. And they're saying we don't want to expand Medicaid and take dollars away from the elderly or the disabled, because any Medicaid expansion, if it's done the way it was proposed in Obamacare, we'll take dollars away from the elderly and the disabled. And that's something that none of us want.
All right, thanks for coming in. Thanks for the update, as always.